Hello, my name is Mara. I'm a dietetic intern at the University of St. Joseph. This podcast involves the analysis of a primary research article titled Therapeutic Effects, Tolerability, and Safety of a Multi-Strain Probiotic in Iranian Adults with IBS and Bloating. To complete this project, I used the Evidence Analysis Manual. This was created by the Academy of Nutrition and Dietetics. The Quality Criteria Checklist and the Evidence Analysis Library Worksheet are useful tools that are helpful when analyzing research articles. The Evidence Analysis Library Worksheet helps to organize the data from the research article and helps determine if it's a reliable source of information, and it also helps determine the strengths and weaknesses of the study to help either draw conclusions or identify areas where further research may be needed. The study design for this research article was a randomized, double-blind, placebo-controlled study. This makes it a Class A, and it also had a quality rating of plus. So this was determined using the quality criteria checklist. The purpose of this study was to determine the efficacy, safety, and tolerability of a multi-strain probiotic combination in Iranian adults with irritable bowel syndrome and symptom of bloating. The effectiveness of treatment effects of probiotic combination was determined using patients with irritable bowel syndrome alone. The inclusion criteria for this study included patients consecutively referred to a private clinical center of gastroenterology in Tehran who were diagnosed with irritable bowel syndrome according to Rome 3 criteria between 2010 and 2012. Their ages were 20 to 70 years old. They had to have complaints of bloating, and they suffered of abdominal symptoms 1 week prior to documentation of baseline characteristics. The exclusion criteria for this study included patients who were not referred to the private clinical center of gastroenterology in Tehran, if the patients had onset of discomfort greater than 50 years old, if they had a steady progressive course, symptoms that lead to awakening from sleep, the presence of fever or weight loss, lactose intolerance, and many others that you can read below. To continue following along with the EAL worksheet, we're now going to talk about the description of the study protocol. To recruit, they used the patients at the clinical center in Tehran with abdominal bloating from 2010 to 2012. The study design, as I mentioned, was a randomized double-blind placebo-controlled study. The blinding used, obviously, a double-blind. Intervention was a multi-strain probiotic supplement or placebo twice a day. The statistical analysis involved continuous variables analyzed by independent t-test and chi-squares. Next is data collection summary. Timing of measurements for this study was 1 week prior and 4 weeks of intervention. Patients were asked to record the same symptoms on a daily basis during the treatment period and report satisfactory relief of general symptoms at the end of each week as a simple yes or no. Then all participants were followed for an additional 1 month after completing the treatment. The dependent variables included irritable bowel syndrome symptoms such as nausea, heartburn, abdominal pain, abdominal distension, and borborygmi. The independent variables was the multi-strain probiotic combination, including Probiotic Quattro Cap 4 or a placebo twice daily. The control variables were the probiotic supplement or the placebo. The data sample initially included 40% males and 60% females. The final number of those that completed the study was 97. 51 received the intervention and 46 were the control that received the placebo. The age ranged from 20 to 70 years old. Their ethnicity was Iranian. Other relevant concepts to note were subjects were to avoid laxatives and drugs affecting intestinal motility, anti-diarrhea drugs, symbiotics, other probiotics, antibiotics, and any other drugs affecting irritable bowel syndrome medication from 2 weeks before starting the study. Also, anyone administered antibiotics during the treatment period was asked to discontinue probiotic therapy and postpone it to 2 weeks after completing the antibiotic treatment. Anthropometrics were not available, and the location, as previously mentioned, was in the Clinical Center of Gastroenterology in Tehran. Summary of results. The researchers' key findings were that 85% of the intervention and 47% of the control reported satisfactory relief of general symptoms. They also saw a reduction in abdominal bloating and pain with the probiotic was superior than the placebo. And finally, there were no adverse drug reactions. Other findings to note are that the sample size was large enough to detect a significant difference. The prevalence of lactose intolerance, which was 64%, was also consistent with other research. There was no adverse effects or safety concerns with the use of probiotic supplements. Also, probiotics are used for preventing and not curing. And their research showed that Probiotic Quattro-Cat 4 alleviates symptoms independent from those patients that have lactase deficiency. Ultimately, the authors concluded that the multi-strain probiotic supplement taken twice daily was safe, well tolerated, and effective for the patients during the duration of this 4-week intervention. Reviewers' comments. The strengths of the study include that the researchers kept participants consistent with their inclusion and exclusion criteria. They used randomization and did a double-blind controlled trial to avoid biases. They also had reliable tests to measure the outcomes. A weakness is that they did not monitor the compliance of participants to taking the probiotic twice daily. Also, the severity of symptoms is up for the individual's interpretation. This seems like a quality study that provides insight into the topic of probiotics and their effects on IBS symptoms. It's difficult to assume the same results for individuals of all races or ethnicities due to a specific population used in this study. The study was funded by a grant from Digestive Disease Research Center, Tehran University of Medical Science. The study medication was provided by a company in Denmark. Now to discuss the quality criteria checklist. The quality criteria checklist is used to determine the quality criteria rating based on the research study. And as we know, this is for primary research. I also discussed this above, and we saw that this study has a positive rating. Basically, the quality criteria checklist involves a series of questions that helps guide us in determining the study's strength by categorizing it as positive, negative, or neutral. As you can see, the positive indicates that the report has clearly addressed the issues of inclusion, exclusion, bias, generalizability, and data collection and analysis. After completing the EAL worksheet, we can now talk about the quality criteria checklist for primary research. It basically will break down the different parts of the study into questions that help us determine if it is a positive plus. So these 4 questions will help us determine that. I'm just going to go through them. Number 1, would implementing the studied intervention or procedure result in improved outcomes for the patients? Yes, we saw that about 85% of patients reported relief when they were taking the probiotic supplement. Number 2, did the authors study an outcome or topic that the patients would care about? Yes, because their irritable bowel syndrome can really affect their lives in a negative way. Number 3, is the focus of the intervention or procedure or topic of study a common issue of concern to dietetics practice? Yes, we could see patients with irritable bowel syndrome in the hospital or outpatient. It is something that quite a few people suffer with. Number 4, is the intervention or procedure feasible? Yes, probiotic supplements are available over the counter. Of course, you have to worry about the FDA regulations, but this is a relatively realistic intervention for patients with irritable bowel syndrome. And like I said, these all indicate that this study was given a plus. There are 10 sections of questions that will help us determine the quality criteria rating if this study is rated positive or a plus. I'm just going to go through the main questions, and you can read through the questions below in that section that help determine the answer for the question that is in bold. So number 1, was the research question clearly stated? Yes, there were very clear intervention groups and control groups. The outcomes were clearly indicated and the target population was very specific. Number 2, was the selection of the study subjects free from bias? Yes. Number 3, were study groups comparable? Yes. Number 4, was method of handling withdrawals described? Yes. Number 5, was blinding used to prevent introduction of bias? Yes, it was a double-blind, placebo-controlled study. 6, were intervention factors or procedures in any comparison described in detail? Were intervening factors described? Yes. Number 7, were outcomes clearly defined and measurements valid and reliable? Yes. Number 8, was the statistical analysis appropriate for the study design and type of outcome indicators? Yes. Number 9, are conclusions supported by results with biases and limitations taken into consideration? Yes. And 10, is bias due to studies funding, sponsorship unlikely? I stated that this was unclear because if they had the medications donated to them, this could make the researchers have some kind of incentive to produce more significant results. But as you can see, as I previously stated, this is rated a plus or positive, and this will be indicated on the evidence analysis worksheet. Here are the references I used for this study. As I mentioned earlier, the title of this research article was Therapeutic Effects, Tolerability, and Safety of a Multi-Strain Probiotic in Iranian Adults with Irritable Bowel Syndrome and Bloating. I used the Evidence Analysis Manual, including the Quality Criteria Checklist and Evidence Analysis Library Worksheet, to conclude if this study was a reliable one that could be used in future research. As we can see, this was a reliable study with a positive Quality Criteria Checklist rating. Thank you for listening.